In this video I'm going to give you a case study to see how you work out what the factors are that relate to the person's development of persistent pain. It's a really simple process when you look at it. I'll explain it, and if you're interested in seeing the details and building up this picture, then watch the video. This patient presented with a 1-year history of lateral knee pain, so pain on the outside of the knee, and it came on with running. And for the last year or so it's been difficult to run because every time they get so far through the run, the pain comes on. Now it isn't on every run. They can do 2 miles one day, 5 miles another time. They could do 2 miles, it could hurt, and then 2 miles it not hurt, then other days do 5 miles. So there's not a consistent pattern. So this 1-year history of pain like that really frustrates the person because they can't do the thing that they enjoy doing. That's their favourite leisure activity, so that's their down button. So we could see from how they're describing it, they're frustrated about not being able to do that particular thing. They can point to where the pain is, so on the lateral side of the knee, and it might run down the leg a little bit. And when pain comes and goes like that, it can't really be just one structure on its own that's injured by trauma. Otherwise it'll be there every single time. So there's this inconsistency. So it almost says it's the nerve, it's the nervous system. So that's a big clue straight away. It's a nervous system. So then I'm asking that person, what happened a year ago then? Well, nothing, no physical trauma. And they're always looking to say what happened physically to them, that they can tell me to help me work out what's happened to them. So we can safely say there's no trauma. So you didn't fall down the stairs, didn't have an accident, no event that's specific from a physical perspective. And they said no. So I said that's good, so that we can be safely confident that there hasn't been any physical injury to cause a pain that's been there for a year, which is true. But the pain's there for a reason. So we then were looking at overload. Well, has there been anything so overloading a few days before that event physically that would explain a pain that's there a year later? Well, the answer's no. And then the clues came in, the running, if you like, because the person said, when I was running to my dad's, the pain came on, and I got there and did what I needed to do, and then ran home and the pain was there. And then other days, I've done 5 miles today and the pain's not there. So there's a big clue to me there. And I said, how's your dad? His dad's not so well, and he hasn't been so well for the last year or so. And I said, what happened a year ago? And the person's mum had passed away, and obviously that's a traumatic thing for anybody. And since then, they said that the dad isn't doing very well since losing the mother. And often I think people transpose how they're doing onto somebody else. I think we all do it sometimes. You put on the behaviours that we don't, maybe are we feeling ourselves but don't admit, but it's easy to see them and state them in other people. So they said that he's not been doing very well since he's lost their mother. And it's really important when you have a very stressful situation like that to have a down button that's does its thing for you. You know, whether it's in a healthy way or an unhealthy way, we have to have something that gives us some relief in that moment. Now it's better that it's a healthy thing. For this person it was running. So you can now see that there's been a traumatic situation emotionally. There's still some ongoing difficulty that the person has to deal with, and their running is the thing that helps them get relief from that, and yet they can't do it. So when you examine someone physically, there's physical findings that fit with where the pain is and the nervous system. So there's tests you can do to stretch the nerve, you can tap reflexes, and you see the sensitivity, and you can compare one side to the other, and you can show the person these things, which is obvious to her. So it's kind of confirming there's a physical element to it. When you have nerve irritation like that for a while, then the muscles in the leg switch off, and they're like the stabilizers that you'd see on when a child rides a bike and they wobble side to side, so that once they get that stability, they ride efficiently. And it's the same with running. If these nerves can become irritated, the stabilizers affected, and you get the person to stand on one leg and they can't stand at all, and then yet they're running on that leg. So it illustrates to them how unaware they are of the difficulty they're having with the body, apart from becoming aware of the pain that appears when they're finished doing what they want to do to feel better about the situation they're in. So you always have to slow the person down, break down the different elements to show them there's something physical they can do that's going to represent them helping themselves and attending to themselves. And going a step further, when the nerve is like that and the muscles around the leg and the knee are like that, so it doesn't have stability, quite often there's a tension in the back. The person doesn't even notice, no pain or anything like that. But when you move those joints, you can see how restricted they are. So it's just illustrating the physical elements to a patient to say, this is the situation this is why you're getting the pain where you are. But this is the driver for the behaviours that are creating those physical elements, creating your pain. So you're taking someone back a bit further. Then you're saying, okay, can't change what's happened. Maybe can't change the ongoing situation. We can make the person feel better about the bigger picture by getting control within themselves, and they do that by attending to themselves physically. So use the physical exercise to represent them attending to them, and that might be a particular exercise to get that stability back in the knee. It might be another exercise to reduce allow the muscles in the back to relax. It doesn't really matter. It has to be purposeful with context of the pain. But when you present exercise to people who have a favourite down button of exercise, their default is go hard or go home. They want to do it 100%, they want to hit it really hard, because that's always the quickest way that they've got their relief, through exercise. So you're asking them to do exercise again, but not with the same intent, at a much softer focus, kinder to themselves, simply representing activities that are going to bring them down each night. And if there's a conditioning element to the problem, then you maybe get them to do that 2 or 3 times a week, but both physical elements that are going to help this person to be done with an intent that really isn't driven, and it has to be emphasised to them. Now, once you've done that, you can see changes immediately. Changes that have been there a year, practically gone within the session, which is amazing when you see it. But there's still an habituation process to make sure that they maintain this, so they can get back to their physical activity, their down button, that's going to give them some balance to the situation they're currently in. It really is a fascinating process to kind of look behind the pain. Yes, look at the physical structures that are relevant, because it's always both. It's not just one or the other. It's never the case. It's always one or the other. Always both elements. There's a physical element, there's an emotional element, and you've got to attend to both. You can't sit there in the room, cross your fingers and go, If someone doesn't want to do the physical element, they can still improve. But if there's a physical element that's needed to be a certain level of conditioning to do an activity, then that's where they have to do the conditioning as well as. And as they do it, they're maintaining the kind of mental attitude and the kind of psychological element as they build up that physical element too. So I hope that picture maybe gives you an idea of how subtle the development of persistent pain can be, and how it doesn't always have to be constant. It could become constant, and it would in this person if they just kept doing it, but it can be a pattern of on and off. It just absolutely confuses the person. It confuses clinicians. I've been confused myself, but now it's crystal clear. I hope that you see your pain a little clearer. I hope that you see maybe your patient's pain, and I hope that case study just gives you some insight into maybe breaking down strategies so that we can reverse that pain.